As some hospitals face a nursing shortage, Ontario's turning to internationally trained nurses for relief. The government hoping to deploy these healthcare workers to hospitals and healthcare settings that need them. But this is a population that says they oftentimes face barriers when continuing their careers here in Canada.
The processing of the licensure is very tedious. It took them at least 3 to 4 years.
Jennifer Lopez knows firsthand. It took her 4 years to become a registered nurse here in Ontario, despite having 12 years experience in the Philippines and Saudi Arabia.
There's a hope along the road, but there is also many room for improvement with the new changes happening.
The College of Nurses of Ontario says they're working to improve the process. 1,200 internationally educated nurses have expressed interest in the new supervised practice experience program that will see qualified applicants who just need to get work experience and meet language requirements work under the supervision of a qualified nurse. Lopez, who heads an organization with over 1,000 internationally educated nurses from the Philippines, says they are hopeful, but there are concerns.
How are the Ontario nurses accepting them? How will be the orientation? And what happens after the 140 hours will be finished?
Lopez says there's no assurance that licensing will be provided afterwards. A CNO spokesperson says, quote, applicants who complete the SPEP successfully will be eligible to become fully registered with CNO. Once the 140 hours is complete, they can use this as their evidence of practice requirement. They can also extend the number of hours if needed.
The safety issue right now is the nursing shortage, which we want to help. Our fellow nurses. We don't want them to suffer.
According to the college, there are 8 registration requirements, from education to experience, exams, and language. It's an expensive and lengthy process, says Aneshka Singham, who is from Malaysia. She moved to the U.S. to get a bachelor's degree in nursing, eventually working as a registered nurse. She gained registration in Ontario 9 months after applying, but currently a gerontology student, she hasn't been able to land a part-time nursing job.
I would have a 20-hour restriction because I am an international student. But, trying to find other ways to get a work permit, it's not really that easy, even though I feel like it should be easier for especially like healthcare workers.
Aneshka says she's one of the lucky ones, but the process isn't easy for these nurses who want to work in Canada.
Their intention was to come here and work and help during the pandemic, but this process was such a barrier that they just kind of gave up.
And Wednesday on City News, we'll tell you about the Toronto hospital that says it's streamlining its process to bring in more internationally trained nurses. In Toronto, I'm Faiza Amin for City News.